Welcome back to the MedTech 101 podcast. And today I got an interesting guest talking about something that I'm starting to see in a lot of spas lately, all the high-end spas, red light therapy. And it's quite an exciting episode we have today with Dr. Kyle Rothschild, who's basically been in the industry for more than 30 years when it comes to red light therapy. So without really delaying any further, welcome to the podcast, Doctor.
Oh, yeah. Thank you so much. Listen, I love talking about red light therapy and helping people in general. I started in the 70s and I was a bit of my version of a hippie. And what that meant to me was my goal was to help as many people as possible. And that's always been my goal to this day. And that was a long time ago. And yeah, I started looking into chiropractic because I felt that drew it. I was so interested in learning more about it. So in 1972, I started doing research on it. In 75, I started school, and then somewhere towards the end of 70s, I started my practice. So it's about 47 years ago that I started in chiropractic and as a practitioner, and I loved it. I mean, I had a lot of success. I've had from time to time, I'd have people thanking me for giving their life back. I don't know. I got a real kick out of that. About, let's say 27 years ago, give or take, I was introduced to red light therapy. And really, there were very few people doing it back then. And I thought I'd bring it into my practice. They likened me to it. They call me a pioneer, but I started when very few people were doing it. Let's put it that way. And the one thing that we knew back then was that it couldn't hurt. But other than that, they weren't sure what this would be able to do, but we knew for sure it couldn't hurt anybody. But I'll tell you, within a relatively short period of time, it absolutely revolutionized my practice. I was able to heal things I never believed possible. And they've done all the research and all the stuff on it. So I'm going to introduce people to how to look up what red light therapy could do for them. So if you go to Google Scholar, which is scholar.google.com, and I'll send you these links and things like that for you to add with your show notes, and you put in the word photobiomodulation, photo for light, bio for tissue, modulation, it does something. And just press enter, and you'll see thousands of studies and reviews and articles about red light therapy, essentially. And then you can filter that down by not only putting in photobiomodulation, but anything after that. So it could be lupus or whatever ailment or issue or condition you want to learn about, how red light therapy can assist you. You can look there. So at any rate, 27 years ago, introduced to red light therapy, and I was having phenomenal results. I mean, the things that this lady had gum disease and I helped her, and this guy had kidney disease and I helped him. I'm not a kidney expert, so I can't advertise. I'm a chiropractor that I can help your kidneys, but don't tell anybody, but I could. So, uh, but that was with lasers and panels and things like that. And then about 13, give or take, years ago, it was discovered that there was an element of light therapy that could help to actually shrink fat cells. Doesn't damage them. It's not like freezing them and destroying them. It's not like boiling them or lasering them. It's not using radio frequency or ultrasonic cavitation. Those are all about destroying fat cells. This is just about a mechanism, which I'm going to describe later, on how red light in particular could actually shrink fat cells and not again not damage anything. So I know that fat loss is huge in the United States. That if you have something where I imagine I can go to people and go, you can be assisted with your diet, not a very, you could put anyone can lose weight if they go on an outrageously restrictive diet, but no one's going to stay on it very long. So if I tell you that you could just go on what we call a calorically neutral diet, which is relatively comfortable for most people. Yeah. If you overeat, obviously the extra calories are going to go to fat. So try not to do that and add red light therapy to it. And we're seeing phenomenal results. It's not just about fat loss. It's about circumferential change. In other words, persons are going to fit better in their clothing. That's the main way I put it. And when I heard that, I said, you know what? That's it. I'm going to get even more seriously involved. And I started manufacturing equipment back then. And we came out, and I was involved with lasers and pads and panels, and we were having nice results. I will tell you, we had hundreds of locations eventually. But about, when COVID first hit, our practitioners wanted less physical contact between the patient and the provider. And we came up with a bed. And the bed is phenomenal. I mean, when people ask me how much does something like this cost, I start off with telling them you don't need staff, so you're saving yourself thousands of dollars right off from there. The patient can get in and out of the bed themselves, and typically they go into the room, they get in the bed, they get out of the bed, they come to the front desk and they wave goodbye as they've already scheduled ahead of time and they've already paid ahead of time. So it's a very easy ordeal. Each treatment is about a dose is 12 minutes. So our practitioners are easily able to see 3 people an hour. So to see 10 to 20 people a day is not a big deal. And yet the financial rewards are great, but really more importantly, you're going to hear some phenomenal feedback from people. So here we are 5 years ago, give or take, learning that we had to come up with a different device other than these pads and stuff because that required staff. So we come up with the bed, and within a first month of us delivering a first series of beds, we were getting feedback that was nothing short of miraculous. I don't know what other way. I know it's not a very scientific term, but that's what we were getting. I mean, this guy would come to us. He was having a heart attack once a week, and it's been going on for 12 years, maybe longer. And every time he died, the defibrillator that they had implanted in his chest would shock him alive again. But by the time we met him, he was probably 18 years or 17 years in this very horrific congestive heart failure that he was going through. And by the time we met him, he was really dying. Nothing was working for him. His organs and glands were failing. His clarity was gone, and he was highly depressed. He had been an athlete prior to getting this congestive heart failure, and it was very disappointing to him, if that's putting it mildly, that he couldn't be active anymore. He could barely make it to his apartment, never mind even exercising or anything like that. So the practitioner calls me up and says, "Oh, I got this guy coming into my office. Should I even treat him? I don't want him having a heart attack in my office." And I told him, just treat him for 5 minutes and stay in the room the whole time. Now, that patient went home. That was almost 2 years ago. That patient's had more treatment, but he's never had a heart attack since that first visit. More treatment. I'm not going to say it was just one visit, but he's never had a heart attack since that first visit. And when you get a chance, I will be sending you videos that you're welcome to share with your audience. And when they watch these videos, it's startling. So you'll hear from Arnett, who's having these heart attacks, and he's going to say something to the effect that one of the benefits he got was that his energy is now through the roof, and he was not expecting that, and that his erectile dysfunction is no longer an issue, and how people actually recognize that he's different because 15 years of dying and now he's not. Believe me, he looks different. So he goes to the church, he goes to the pastor, and he says, "Hey, remember me? I had a heart attack in your church." And the parishioners would come up to him and they go, "Oh my God, you look and sound so different." And he would go, "Yep, red light therapy." And that's the kind of feedback we get from a lot of people. I do recommend people go to our YouTube channel, and they will see over 120 really great videos on understanding all that. And again, I'll send you the show notes, but the YouTube channel is, you just go to YouTube and put in Trifecta Light Official. So the name of the company is Trifecta Light. The name of the bed is the Trifecta Light. And the reason we came up with that name Trifecta had to do with the triple effect of face, fat, and healing. That was initially what our equipment was. It was when we created the bed, it was really much more than that, because it was really not just face, but skin from head to toe. So even very serious psoriasis, eczema, serious acne, any of that stuff, the response is spectacular. So anyhow, that's the history of getting involved with beds. And that first bed we developed several years ago, we've now had at least 6 renditions, improvements over the bed to always get what we're looking for, which is you want very strong lights that don't get hot. See, heat is the enemy. If the lights get hot, which is a lot of these cheap devices and the ones at the gyms and the ones in the various different places, they're cheap. They get them, they either have fluorescent tubing. Ours is a medical grade high end device. So it can burn really strong, but not hot. Why is heat the enemy? What heat's going to do is it's going to dilate blood vessels on the surface and bring more fluid to the surface, in particular blood. So when I put a heat pack on a patient's back and then take the heat pack away 10 minutes later, it's bright red underneath. And the reason is because all that heat has been attracted to the surface. And that's not what we want with laser therapy or with this type of red light therapy, I should call it, because that's going to block the penetration of light. You want to be able to not have that. So when we first came out with these lights 27 whatever years ago, we called it cold laser. Not that the lights were literally cold, but they didn't get hot. And that's the ultimate goal, is to have very strong medical grade lights that don't get hot. So that's where our bed comes in. Medical grade, doesn't get hot, but it can be customized to the individual. So a 400-pounder who has a lot of flesh can absorb a lot more power of the energy and not get hot. Whereas an 80-pounder who has almost no flesh, we would have to set the settings to customize the treatment specifically for that person. We also have the capability of pulsing the wave. So by pulsing the wave, what we're able to accomplish with that is resonating frequencies. I don't know if you've heard of that. So there are healing frequencies. A lot of you people have heard about maybe PEMF mats, different things that will assist in these type of things to assist somebody. So by resonating frequencies, by changing the frequency of our light bed, we're able to resonate with different tissues of the body, and it works. It will enhance the results we have as compared to our first bed, which was a constant wave. We were not able to pulse that wave back then. So you're looking for a bed that is strong, not hot. You want a bed where the top canopy comes right down on the body. And again, I don't have an objection to face masks and helmets and all these other wonderful things, but you're not going to get the miracle from that. Yeah, you'll get some skin that'll look on the face will look better. On the helmet, yes, it helps to a degree. But the truth of the matter is, and remember, the lights can penetrate the skull and get to the brain. So I had a lady that wrote me, this is what she wrote me. If this is how normal people feel every day, I can't believe I've been missing out all this time. She was so depressed. She was so, she hated her life. And now, after a relatively short period of time of being in the bed, over a couple of weeks period, she's got joy in her life for the first time in a very long time. And she doesn't have that utter depression that she had prior to that. So there are actually 8 divisions to the company. So we talked about skin, originally it was face, fat, and healing. That created the name trifecta, or the triple effect, face, fat, and healing. But it's really skin, fat, and healing. But then there are 5 other divisions to the company, which includes men's health, women's health. With women, first of all, with the hair with periods will be much less painful within a month or two of treatment. But hair restoration. So women, as they get to a certain age, they start noticing more hair in their hairbrush or more hair at the bottom of the drain after they shower. So they're starting to thin out, and the red light therapy is able to reverse that. And so that's a
True.
beautiful thing.
Yeah, thank you, Carl. And I think you've said quite a lot of stuff there. And as you can see, I've been jotting down notes of many points to come and ask you, because I'm sure many people listening to this were wondering, how does it look like? How does it work? And basically, it's like it's essentially looks like a tanning bed, essentially, for most people who just wondering how it looks like. And that it's got red lights on it, and people can sit on it, or not necessarily like lay down on it, and then they can go through this treatment for 12 minutes, as you say, per dose. And just to wind back a little bit, because I want you to explain further on a few points for people. Um, is that when you say that it's like a photobio modulator, when you say that, could you simplify that just to let people know is that the red light that touches their skin does go through? Because one of the things that I do try to really do on this podcast is to try to really break down all the nuances or the the jargon for the ordinary person who doesn't have any scientific background, to also consider this and realize that this is where the technology is, and
Well,
it's a
50 years ago, the NASA coined the phrase photobiomodulation, meaning photo for light, bio for tissue, and modulation, it does something. So when you put in to that, when I told you about Google Scholar, if you put in the word or phrase red light therapy, it's going to be misleading. You're going to get millions of hits with that, but some of the hits are just on red or just on light. So it's better. Photobiomodulation will get you a more targeted series of studies. So photo, 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 bio meaning tissue, and modulation meaning that it does something. So 50 years ago, when they first started doing research to find out how light could affect tissue, they came up with that name. But I just want to finish with the 8 categories. So we talked about face fat and healing, but really skin fat and healing. Then men's health, erectile dysfunction, and a variety of other things. Great results with that. Women's health, we talked about less painful periods. We talked about hair restoration, and also even we've seen cysts, ovarian cysts, kind of fade. And so even endometriosis, if it's not too severe, we've seen beautiful results with that. But you don't have to take my word for it. Again, you're going to go to Google Scholar and look these things up. So we got the other categories besides men's health, women's health. One of the great categories is athletes. So if you're an athlete, a serious athlete, and you want to perform better, by getting in the bed, you will perform better. I've had people call me up and say, I can't believe I can swim twice the distance I used to be able to swim because of just getting in the bed. That's the only difference in their life. And also not only swimming further, but having more stamina, having less likelihood of getting injured, but also the other division of the athletic program, which is performance, getting in the bed before your activity, but getting in the bed again after your activity, and you'll recover much quicker from an injury or overuse, strain, things like that. And so from the musculoskeletal point of view, we also see phenomenal results as well. So anyhow, I just want to make sure I covered those 8 categories.
Of course, no, that's fine. Thank you very much, and I do agree with you, because one of the reasons why I agreed to also like bring you on the podcast is because with most of this, like sort of like fitness influencers, athletes on their stories in social media, they tend to be shown or sitting in some like red light room, or with a red light, or people doing it to improve their skincare and everything. So I don't doubt its efficacy and clinical efficacy in terms of helping people out there. So I thought this would be something really cool, something that's also kind of trendy at the minute. But like I know you mentioned like all the benefits of how it works, and it seems to be quite like a wonder kind of type of therapy that really seems to be applicable to everyone. Like if someone asks you like what's the secret behind it, like what makes it so effective, like how would you go about that, like what makes red light
And that's the
therapy
next part
effective?
of this presentation. So how it and why it works. And by the way, in the beginning, they didn't know why or how it works. And again, the only thing we knew in the beginning was that it couldn't hurt. That was it. Um, and there are 2 completely separate mechanisms. One is the healing mechanism, which I'm going to review in a moment. But before I even talk about that, the other mechanism is the fat loss, which is completely different. And the fat loss mechanism that they discovered by accident has been shown that only red light, not the near infrared. So our bed is integrated with red and near infrared. In fact, we were the first company 12, 13, whatever years ago to integrate red and near infrared. Red, somewhat healing, but phenomenal for fat loss. Near infrared, nothing to do with fat loss, but great for healing. So when you integrate the 2 together, you're going to see, for example, someone who wants to lose weight, you're never going to see sagging skin. I can't use the word never. You will not see stretch marks, sagging skin, or anything like that when it's combined, because the near infrared is going to make sure to tighten the skin, whereas the red is the one that's helping with the fat loss. So let's talk about how red works. What they found is that originally they thought it melted the fat. Well, that's not what happened. Again, we're avoiding heat anyhow, so there's no melting. What they did discover is that there's an element of this red light, certain wavelengths, that will actually change how porous the outside wall of the fat cell is just temporarily. So it allows the contents to leak out into their surrounding tissue. And with our unique protocol, we move that fat away from the fat cells and eventually to the liver for use or elimination via the lymphatic system. So that's how simple it is. The fat loss is not complicated. Um,
As much as I understand that with the fat loss, you can attach it how it works. But since you mentioned other points, I don't want to keep the audience waiting because I'm sure they're also waiting to hear about how what makes it effective for the other points you mentioned.
all right, so then let's talk about how it heals.
Definitely, and also like if you also like time limited right now, it's fine. Like all the other points that you're mentioning right now, like guys, if you're listening to this or watching this on YouTube, I'll also be putting those links below as well because I understand
Okay.
we not have enough time to cover everything, so we can cover the most exciting parts, I guess.
All right, well, get
Okay.
ready to get excited because here's what happens with the healing. So again, when it first came out 50 years ago, when they were starting to do research and studying, they didn't know why it worked. But what they realized is that what they were taking is elements of sunlight. And for centuries they've told people, go sit out in the sun, and that will help you with your ailment, whether it's tuberculosis or whatever the person has. Well, imagine taking sunlight, the healing aspects of sunlight, not ultraviolet, not blue, which screws up the circadian rhythm, not any of the other colors, but we're going to take certain elements of sunlight, which is red and near infrared. And we're going to talk about infrared in a moment, but um, red and near infrared. Red, again, near infrared by definition is called cold. Not, it's known as cold, and so is red. Whereas some of you people are familiar with far infrared devices, and in most people, when they just use the word infrared, they're really talking about far infrared. That's for heat, and that's all it is. I mean, it's nice, gets hot, but it's not really going to give you long-term changes to the body. So we're going to be talking about primarily near infrared, but a little bit of the red. What does it do? So what happens is it'll affect we know that your body is made up of tissues. Every tissue is made up of cells, and every cell has this thing called the mitochondria. One mitochondria in every cell is what I learned when I was going through school. By the way, that's not true. The mitochondria is so prevalent in your body that there's not just one in every cell. In fact, the heart, which has the highest demand for energy, has over 5,000 mitochondria in every cell. Because the mitochondria, well, what's its role? It's about the powerhouse of your body. It gives energy for you. It's the reason why you breathe oxygen and eat food, to create energy. And that energy is also to every function in your body, but also, guess what? Healing. So if your mitochondria is not doing its job, and the job, by the way, is to produce a molecule called ATP. And that ATP is considered the energy currency of the body. That's what the body uses, the ATP, to generate the energy for your whole body. So if your body is not producing the correct amount of ATP, then you're going to wind up eventually with disease and ultimately with death. So to rewind that or unwind that and to get you the best results is you want to figure out, well, how can we stimulate the mitochondria to come back to life? And what they discovered is that there are elements of red, but more importantly, the near infrared, that will stimulate the mitochondria to do its job. Now, how does this happen more specifically? Within each mitochondria is an enzyme called cytochrome C oxidase. That enzyme is a chromophore, which means that it's stimulated by sunlight. Not every part of your body is stimulated by sunlight. A lot of it is. But one of the most critical chromophores, which is stimulated by sunlight, means it's receptive by the sunlight, is this cytochrome C oxidase. So the certain wavelengths that we use, red and near infrared, will stimulate these cytochrome C oxidase to stimulate the mitochondria to come back to life, to come fully back to life. And that's why you're seeing such global, outrageous results from head to toe. Every part of the body can be affected. And this was not true before when I was using lasers and I was using pads and things on the wall and all kinds of stuff. That wasn't true because what we learned is when you bathe the whole body at the same time, that's when you're seeing these miraculous results. So you're going to see Arnett that was having a heart attack once, if not twice a week. And I told you about Arnett, right?
Yes, you did. And I mean, like, to me, all this you saying is also sounds like a bit of like a biohack, essentially using technology to go back into your body, rewire things, get things firing up. And you did mention, Annette, talking about how you went from having a heart failure essentially regularly to basically being okay. And like, this is quite a curious case, really. It made me kind of wonder because it made me think that maybe there's a lot more that perhaps we don't know if it worked for him, and that was it, maybe if there was no other factors that contributed to him feeling that way. But yeah.
Not one thing besides red light therapy. Listen, he went for the treatment, goes home that night, and that was 2 years ago, and hasn't had a heart attack since. He's had more treatment, but no more heart attacks. So I've had people say, "Oh, it must be placebo." Are you kidding me? This is not a placebo effect.
And I'm sure a lot of people right now listening to the podcast will be saying like, yeah, it's probably a placebo or it's not
Well,
a
go to
placebo. So I'm
Google
happy you
Scholar
mentioned.
and look at that and see that it's for real. And all you need to do is experience this 6 times. That's 3 times a week for 2 weeks. Just try it for 6 times. And at the end of the 6 visits, if you don't see a change, any change at all, then you're right. Red light's not for you. But that's rare. That's rare that after 6 visits, the person doesn't see any change at all. So even Parkinson's and dementia and Alzheimer's, multiple sclerosis, and any autoimmune disease and Lyme disease. We had Steve that had 40 years of Lyme disease. It ruined his life. He was so depressed. And I'm going to send you the videos, and I welcome the audience. Watch this video by Steve, because that one is earth shattering. It's incredible. And then Jessica had 16 outrageous conditions. I mean, she every part of her body was suffering, including Lyme disease, shingles. She had 3 forms of psoriasis, including guttate psoriasis, plaque psoriasis, and psoriatic arthritis. And she was seeing doctors and taking drugs and getting injections all month long, every month. She didn't have time to do almost anything else. I'm exaggerating, but she was very involved with doing all these things for her health so she could survive. And after just a short period of time using red light therapy, she doesn't need any of that stuff. Everything has come back to life. So when you get a chance, watch that video by Jessica. I mean, it's, like I said, it's
Yeah,
earth
definitely.
shattering.
And as I said, I will basically be putting all the videos like in the link below of
I'll
this
send it
podcast,
all
and
to
some
you.
of them I'll be putting it on top of the video as well for people to see. But I really love how you're so confident about this, and I'm sure a lot of people will go ahead and try it. I mean, you've got nothing to
Well, let me
lose.
tell you how they can try it. They go to the website, which is trifectalight.com. When you go to trifectalight.com, you go to the Contact Us page. On the left side of towards the top, it's for you that wants to just use it and try it out for those 6 visits. So click on that. We can't list all the locations. We have hundreds throughout the country. But just click on that and we'll try to find a location closest to you. On the right side is for somebody that might want to buy this. So I use it. I'm 72 years old. I use this at least 3 times a week, not because I have a particular ailment, but as I taught my patients, it's about aging gracefully. You can't do anything about getting older. I mean, you're gonna get older, but wouldn't it be
Yes.
nice if you did it better? So we're gonna have you age gracefully by using red light therapy. And so that's the maintenance for me. But if you have an ailment, you get in the bed, 6 visits. At the end of that 6 visit, I would be very surprised if you don't see some change. Some people's problems are so traumatic and tragic and so severe that might be subtle after 6 visits. But it's the first time they've seen even a window of hope where they can actually see these results. So there are 2 reasons to buy the bed. One, you have more money than well-being, and you realize that this is something people don't realize how expensive it is to be sick, especially in the United States. It not only ruins your life as far as social life, as far as business life, but it also is expensive. This lady that I was telling you, her copayment for the drops in her eye were $400 a month. And then she had to get injections in her eye once a month. Those were $5,000 per injection. Yes, insurance paid parts of that, but her monthly expenses for healthcare, for all the drugs and injections she was getting and the doctor visits, was astronomical. So people don't realize how expensive it is to be sick, and they're not scared enough, and they don't take great care of themselves. That's the most important thing. Is take care of yourself when you can, so that when you're older, you're not your 70-year-old, 80-year-old self not looking back at your 30-year-old saying, "Schmuck, why didn't you take better care of yourself so I'm not suffering, so I'm not an invalid?" Because that's what's going to happen to people when you don't take care of yourself.
Makes sense, and I agree with you on that because, healthcare in general is quite something people do spend a lot of money, particularly in the US. And But I'm quite curious in terms of like, what do you think the biggest hurdles have been? Really, I mean, coming to the adoption of this, the biggest hurdle that red light therapy is been facing, besides people going through this sort of like way where you have to teach the market about how effective it is, and that's not a placebo. What are the barriers or hurdles, if you say, that have been making it
I don't
less
understand that word. Hedo, the
so
hassle,
like hurdles, essentially, like, challenges
hurdle.
that you face,
Okay, hurdle.
hurdles.
All right. I'm from Brooklyn, New York, so hoidle. But you know what? I'm going to table that question for you. But I want to
Yeah.
just talk about one other kind of person that's going to want to buy
Okay.
this bed. And that is somebody that understands and recognizes that this is huge for business. So if you have this bed, it will become a centerpiece. It will be a magnet for everybody in the community to want to use that bed, but it will also be a great tool for all the patients that you already have, or clients, or whatever you have. And so because it is so safe and there's never been a recorded side effect, you don't have to be a health practitioner to use this in your practice or business. And on a contraindication, so side effects, there have never been a recorded side effect. On the contraindication side, meaning who can't use the bed, the only people who can't, who we emphasize, are pregnant women. Now, it's not because it will be harmful to the fetus and mother. In fact, quite the opposite. It will be helpful to the fetus and mother. But if that baby comes out anything other than perfect, they're going to want to blame somebody for that, and you don't want to be in that neighborhood. So just don't treat a pregnant woman until after she delivers, and especially if she has a C-section, get her in the bed the day after that, and she will recover from this C-section so fast, and the scarring will be so minimal compared to what she would have otherwise. So that's what I wanted to emphasize there. And now you asked me about hurdles. There's one major hurdle, and that is you have a gentleman here. He's a medical doctor, and he has the opportunity to make $30,000 doing this, whatever that is. Let's call it surgery, or not make $30,000. What is the average person going to do when you put that, when that option is there? The reason why this equipment is not in every hospital is because they will look at it as a revenue killer, because people are going to need to go to the hospital a lot less drugs, less surgery. And that's not the interest in this country. In the United States, it's about making money. I don't object people making money,
Yes.
but imagine you've got people in charge of our medicine, our medical world, who are profit centers. And again, I don't mind them making money, but if it's instead of the alternative of not having to have surgery, or not having to live my life with 16 horrible ailments, with all the drugs and all the injections and all the doctor visits, and if I can not have that, that's the route I'm going to go.
True.
Anyhow, you can
True.
get me
Makes
going.
sense.
I don't want, I mean, I know.
No, it's really good to listen to this because I know it's fine. It's fine, right? It's sometimes you need people to come and give opinions that perhaps they're not used to hearing, and I think there's no denying that there's an element of like human greed that exists in some of the systems, particularly the healthcare systems we see around the world. So it's interesting to for you to share that.
Have you seen my
Even
mug? Do you see what it says?
What does it say? Could you read it out for people listening?
Get in the bed.
Yes.
You see it?
And no, thank you
This
very
is
much. And
my attitude. It's just try it for 6 visits, get in the bed. I'm not in practice. I'm not inviting you to my facility. I'm telling you, we have hundreds of locations all over the country, and just at least try it. It's only in the United States. We have a little bit in Canada and a little bit in Mexico, but it's mostly in the United States. We're trying to get it into other countries, but it's been very challenging.
of course, I understand. I understand, and but it takes time. Essentially, you once you get those market approvals, because the technology is quite set. As I'll also be showing those papers. But like since we're getting towards the end of like our chats, I would ask you, like, what do you think? So you spent a lot of time talking about the current state of the industry when it comes to red lights, but like, what do you think the future is for red light technology? What do you see us going?
Well, in the United States, we now have a RFK Jr., who's in charge of health, sort of in charge of health in the United States. And his attitude is let's maybe emphasize health rather than wealth. That doesn't mean people aren't going to make money, but maybe they're going to make a little less and emphasize more helping people. So, as far as the future is concerned, I'm going to tell you something that's going to tick some people off. But if everybody got in this bed 3 times a week, the amount of drugs needed, the amount of surgeries needed, and the amount of hospital stays would drop outrageously. And the amount of well being days in your life. Again, remember, it's about living your life like a candle that burns really bright from the beginning all the way to the end and then sputters out and dies, not spending the last 20 years of your life as an invalid. As you can't even take care of yourself. You can't bathe yourself. You can't feed yourself. And you can't even wipe yourself. I don't want this. And I don't want it for you either. So do the smart things. The reason why people don't sometimes don't take care of themselves is because they're not scared enough. So if you want to get scared, go to some of these facilities where senior citizens are retired to, and see not the active ones, but see what some of these people who've not taken care of themselves, what their life's like, and they're just sitting in a wheelchair, talking to themselves, and not having a very fruitful life. And I'm just telling you, maybe you should be looking at ways to make your life better. And it doesn't mean you never can have a fun again. I'm not saying don't drink, don't eat things that we know are not great for you, but don't do it that often.
Mm,
I don't drink. I don't drink alcohol at all. I don't eat. I don't put anything in my body that I think might be harmful. So I don't have gluten. I don't have dairy. Don't you know, I drive people crazy, so I don't want them to think how nutty I am. But I get scared to how my future would be otherwise, and I want to take care of myself. So three
yes.
times a week at least, I go to the gym. I do the most important aspect of gym is cardiovascular. So I'm going to be on the treadmill or elliptical or bicycle, whatever, to get the heart going. You want to get it at a certain target level, which you can look up and find out what's right for you. So it's smart eating, smart exercising, and red light therapy. Yes, I'm
Mm,
obsessed with red light therapy, but I wouldn't be this way if I didn't get so many people contact me and they're saying the following that you're going to hear a lot more as you get more involved with red light therapy. And it's thank you for giving me my life back. And
sure.
what is
Thank
more
you.
rewarding? Why did I become, as a hippie back in the 70s, why did I become a chiropractor? Because that's what I wanted to do. Help as many people as I could have a better life.
Sure. No, thank you very much, Dr. Cow. I think
My
that
pleasure.
that shed a lot of light on a lot of people. And again, I'll be putting all those descriptions below.
And
So
I'll
yeah,
send
but
you
thank you
some
very much.
information that you can add as well. So thank you very much. And everybody, you take care. And I wish you the best.